Hi, I'm Paula. I'm Jaime's neighbor.
Hi, I'm Natalie. I'm his mom's friend.
I'm Aurora, neighbors Jaime.
Alright, today I will be speaking about dialysis. Dialysis, what is the first thing that comes to mind? I personally didn't know what this word was. I never heard of the word. I knew it was familiar, but I didn't know what it was about. Today I will be speaking about dialysis and just giving you some insight on the topic and what it is, and basically just giving some details about it. Hopefully you can leave today with little knowledge on what it is and an idea next time you hear this word. Dialysis, according to Merriam-Webster Dictionary, is the process of removing blood from an artery as of a kidney patient, purifying it by dialysis, adding vital substances, and returning it to a vein, called also hemodialysis. There are actually more than 3 different types of dialysis options. The one I will be speaking about today is called hemodialysis. We have about 5 different types, those including peritoneal, hemodialysis, home dialysis, in-center, nocturnal dialysis. But today I will mainly be speaking about hemodialysis. Basically, what hemodialysis is when people like you and I have a kidney disease that affects the way our kidneys work. Sometimes people have chronic kidney disease, which they are born with, and some have a sudden onset as a possible side effect from a medication or other disease affecting it. There are 2 major causes for kidney failure. Those are diabetes being number 1 and high blood pressure being number 2 on the list. So if you haven't figured it out yet, dialysis all has to do with the kidneys. The kidneys is what filters and removes fluid from your body. And hemodialysis is for people with kidney failure whose kidneys are no longer working correctly. The function of the kidneys is to filter toxins out of the body and get rid of excess fluid, according to WebMD. Hemodialysis is basically using a machine which works as an artificial kidney to clean the blood of your toxins in your kidneys when they can no longer due to lack of function. A great source which explains it in detail is at www.kidney.org. So basically, kidneys is when your kidneys are no longer functioning, basically due to failure of some other type of disease or medication. And I don't think people realize that if your kidneys don't work, basically your body starts shutting down little by little, and your body can't get rid of these toxins, and you become septic, and you start getting filled up with fluid, and eventually you die. I know some people go down from 100% working kidneys to 20% working kidneys just within a couple of weeks. Basically, dialysis is a form of extending your life. The way dialysis works is basically, lots of people don't know they have kidney disease until one day they go up to the hospital thinking they have pneumonia because their lungs are filled with fluid, and they just think they have a case of pneumonia, when in reality they end up getting told their kidneys are no longer working and they need to get dialysis. The first step in dialysis is getting a catheter, which you get 2 lines put into your heart. One comes from an artery and one goes into the vein. That's how you start dialysis. From there, you will get another surgery where you get a fistula. Basically, they put an artery and a vein together to have more blood flow, and this is where they will be using the spot they will be using when they use the needles to filter your blood with this machine. It's about a machine like this tall. After that, you can decide whether you want to keep doing dialysis in a dialysis center, or if you want to keep doing it at home, or if you want to do it at a clinic overnight. But dialysis is, they use, basically it's a filter on this machine that filters the blood in your body, so when your kidney's no longer working, it filters it. Dialysis does not cure kidney disease, and it does not make it better. The only options to cure yourself from kidney disease or kidney failure is getting a transplant, which for most people takes a long, long time. Kidney disease is basically an only life extending thing. You know, once you stop going to dialysis, basically it can be from a matter of 2 days to 2 weeks before you eventually die, because your body is not filtering all these toxins out of your body. So you have to do dialysis about 3 times a week. Where I work, most people do 3 to 4 times a week, and you have to sit at this machine 3 to 4 hours at a time while this machine filters all the blood in your body and removes the excess fluid. Like I said, dialysis is just a way of extending your life. It doesn't fix the disease. Once you have it, you have it, and it's basically the #1 and only option when you do have kidney failure, and it's the only thing that keep you alive when you have kidney failure besides a transplant. Like I said, this is the only option. People who opt not to do this basically, you know, have a DNR or something, a living will, to where they get to a certain state in their life and they just choose not to continue on with these treatments and have their life end. Everybody has their choice on what they do. This is just, speech was basically just to give you an idea, not really explains it all, but just gives you a better idea of what dialysis is and how it works, and basically what I do, and just so that way next time you guys do hear the word dialysis, you have a better idea of what it is and why we do it and how we go about doing it. Hopefully in future speeches I will get more into detail as to the process of how we start a treatment and how we end it, and why we use the things we do, and all the other complications and things that go along with doing an actual treatment when it comes to doing hemodialysis in a in-center or in a clinic. But hopefully you guys learned something today and just have a better idea of what hemodialysis is. Next time you do hear a word, some people just call it dialysis, some people call it hemodialysis, but hemo basically means blood. So any word that has hemo in it, hematology, hemodialysis, basically has to do with blood. But yeah, hopefully you guys have a better idea of what dialysis is, and next time you hear the word, you know what they're talking about. Thank you for coming today. That is all for today.